Hello, and welcome to today's EHS Today webinar, Total Worker Health Assessments That Really Work, Getting a True Picture of Your Workplace Wellness. It's sponsored by BSI. I'm Dave Blanchard. I'm the Editor-in-Chief of EHS Today. I'll be the moderator for today's webinar. Before we begin, let me briefly explain how you can participate in today's presentation. So first of all, if something doesn't seem to be working right, maybe you're having some audio difficulties or the slides don't seem to be advancing, easy way to fix that is to just hit your F5 key on your keyboard to refresh your webcast console. Now, if you're running pop-up blocking software, you're going to want to disable it to view this webinar. And if you have any other technical difficulties during today's session, please press the question mark help button. You'll see that in the upper right corner to receive assistance in solving any other common issues. This webinar technology will also allow you to resize the presentation. To do that, just click the maximize icon in the upper right corner to enlarge the window. We welcome your questions during today's event. To submit a question, simply type your question into the Ask a Question window that's on the left side of your console, then hit the Submit button. We'll be answering as many questions as possible during the Q&A session that will follow the main presentation. But please feel free to send in your questions at any time, and we'll add them to the queue. And please also be aware today's session is being recorded, and it will be available on the EHS Today website within the next day for you to review. You'll be notified by email just as soon as that archive is available. Also, when this webinar ends today, please take a short moment to complete a feedback form that will appear on your screen. And that seems to be it for my housekeeping tips. Let's now meet our two speakers. Joining us today, first of all, we have Dee Dee Montgomery. Dee Dee is an industrial hygienist and program manager with Legacy Health. Dee Dee currently works under a grant from the Health Resources and Services Administration to reduce burnout and improve well-being for a workforce of over 22,000 personnel while moving toward the total worker health approach. She's past president of the ASSP Columbia Willamette chapter. She served at the Oregon Health and Science University as a practice lead, and she was a co-principal investigator and senior research associate working as a certified industrial hygienist. Joining Dee Dee today is David Natalizia, BSI Group Principal Consultant, Safety, Health, and Wellbeing Solutions with BSI Group. David works with performance and leadership-focused clients to help them pursue excellence in workplace safety, health, and well-being solutions. With expertise in safety and risk strategy, leadership, and safety culture development, David is often called upon to identify and remediate specific risk drivers, such as sprains and strains, slips and trips, machine safety, and work at heights. If you'd like to learn a little bit more about our speakers, you can check out the Speaker Details tab on your console. So I am now going to step aside. Welcome to you both. The floor is now yours.
Thank you so much. We're glad to be here and really eager to get into this. It's a topic that I'm sure everyone's heard about and dealt with, and we're going to rely on a lot of what has been done by some great folks in the field before, but we're going to introduce a couple of new angles and new dimensions, and we're going to jump right in with some interactivity as we get started. So here's a poll. Please share. Do you have a written policy related to well-being? And I think view this broadly, right? But we do want to get a sense of kind of where you stand organizationally with this. And we'll give people just a few seconds to answer. And then we will take a look at what people have to say about this.
Thanks, David. That's really interesting, isn't it? And not maybe surprising as they start to pop up here. I see nearly 60% folks saying no. Maybe, well, let's give it a minute, shouldn't we? It's changing up.
So taking a look at this snapshot, so we do have that sense of about half of the participants really don't have a written program in place. Although we look at that mixture on the other side, the folks that have got one or have it in progress or planned is the other piece. So I think no matter where you are on that spectrum, you have come to the right place. Let's take a look at what we're expecting from today. Dee Dee?
Thanks, David. Yes. So first of all, we do want to make sure we recap what do we mean by the total worker health approach. We're not going to spend very long on that. We'll have resources to support you if you need more, but it's important that we start kind of at the same place together. And then within that, we're going to really look at what do we mean by, well-being assessment. I think that's what we hope to spend most of our time on, but I think it's really important to think about the variety, diversity within our organizations as we do that. And then David?
And then taking a look at some challenges and lessons learned from doing this in the real world. And I think this is a great thing to look forward to when you talk about your takeaways from this session, taking what's been well researched and done, I would say, in some pretty kind of carefully constructed environments. It's really worthwhile taking a look at what happens when you bring it out to different real world situations. We'll make sure to spend some significant time on that.
Thanks, David. I think also I would just, before we jump into this slide, say, even though maybe there were a third of us that in fact say we have well-being programs or policies, we probably, if we were to ask you to raise your hand, you'd say, yeah, but it's not where we want it to be. So we get that. And so first of all, we're using this term, the total worker health approach, and you've probably seen the definition before. I'm not going to read it to you. But what I really like to emphasize over and over again is that this is an approach. This is a framework. Many times it's referred to as a program. And so I really want you to think big here, which also means it's really complicated. It can feel very complicated. So if we really go on to the next slide, these are the things I'd like to make sure we emphasize at the outset about really what we mean by this total worker health approach, which, by the way, that is a term that comes to us from NIOSH, the National Institute of Occupational Safety and Health. If you've been in the field a while, you might recall when it was originally called the Work-Life Initiative. There's a few things that I really like to remind us that set us off from what might be a traditional wellness approach or a wellness look at work. The first thing, and I'm going to jump into the middle check mark there, safety is foundational. There is really this belief that if we don't feel safe, and safety has many different ways of looking at it, right? That can be around violence protection. It can be around from a psychological safety standpoint. It can be around workplace exposures, whether it be safety or industrial hygiene or chemical. The point being that we will always come back to, and you're going to see this as we get into the assessment, safety is foundational. Secondly, we're really talking about integrated related programs. This is, in my opinion, sometimes the most complicated part of this, and we'll come to that. Finally, as I alluded to earlier, work and life are connected. We are aware that what we do at work sometimes goes home with us. It impacts our health and well-being. It impacts our family and our communities. And what happens to us outside of work can come back. And so it's not that as employers we can take care of all those problems or help them go away, but it means we really need to think of the way we can best support people at work and support them outside of work when we can. I really like to think about how can we help people feel safe? What info do we need to better determine that? And how can we make work better? I finally, and before David's going to share a couple more things on this slide, I'm going to remind you, if you need reminding or if it's new to you, the picture on the right, that's the cover to a document that's freely available from NIOSH. called The Fundamentals of Total Worker Health Approaches. And if you haven't looked at that before, I would absolutely encourage you to check it out for some more basic information on particularly things on this slide. And in fact, we have that listed as one of our resources.
Thanks, Dee Dee. There is that idea of both the resources here and the content, right? So that booklet or virtual booklet is useful. Get yourself a copy of that downloaded, take a look at it. And there are some things in that booklet that are pretty useful. One of the things that will come up in a later slide is a list of traditional and non-traditional safety and health efforts and how they relate. And it fits right into what we're talking about and what Dee Dee mentioned about safety being foundational. Consider that when you view total worker health or well-being overall as something that is separate from traditional workplace safety, you're dooming it to fail. You have to start with traditional workplace safety and health. Think about that. If someone is going to avoid some of these other things that have been neglected or not well considered, you need to start with reasonable controls in the workplace. You need to start by making sure that you engineer out what you can and don't just have it be rules or training that you expect to protect yourself. Shades of the traditional hierarchy of controls. You'll note the version of the hierarchy controls on this page is one that NIOSH refigured for total worker health. Each one of those sections of the inverted pyramid has an explanation of its own. So it's worthwhile to take a look and get into that. What I want to spend the last bit of time on this slide talking about, though, is the pillars in those central bullet points and a few things that relate to these approaches. First of all, leadership commitment is essential. And I would suggest a test for all of you when you're doing your implementations and your evaluations. And that is find out what organization top-level leadership has to say about their hopes and plans for this. Because what we'd love is if someone says, I'm not exactly sure the definitions or what it means or what it encompasses, but we know there is some real, we need to get our arms around it. We need to figure it out, but we need to put some resources toward this, and these efforts will do that. I mentioned that. I just mentioned that. Oh, go ahead. Yeah.
I'm sorry, I wasn't going to do that. I just want to add to that. I think what's really important too is to really distinguish between tactics and strategies as we go through this on all of these levels. And we'll come back to that when we look at our overall assessment. Thanks, David.
And then you'll see the other bullet points talk about some of the other things that you're going to look at. And the one that sometimes is a little bit uncertain for some people who see this for the first time, it's the idea about ensuring confidentiality. And part of that, if you've seen the work on psychological safety and the different pieces of psychological safety or ISO 45003, freedom to share, to question, to challenge, and to have a time and a place for that to be something that is done where someone knows that it's protected, that really helps. Now, we're not saying that the totality of someone's time at work needs to be confidential. We know that's not realistic, but we're saying there are the times and places for it in these efforts. And then there's the last bullet as we move to the next slide is the idea of integrating relevant systems. It takes multiple systems to do this, and be ready to think about single factor solutions. This program or that program. How's that? Is that our total worker health program? Is that our well-being program? Probably not. Could be a cornerstone, could be a major piece of it. Unlikely that any one effort, it's integrated systems that we're seeking. So with that, we're going to advance to our next survey. In your organization, who's responsible for well-being? Whether or not that is defined yet, just practically, who ends up being responsible for well-being in your organization? Go ahead and weigh in on that. And this is the reality. I'm not asking you to tell me theoretically who's responsible. I'm saying if somebody said we need to improve our efforts, we need to start a program, we need to do whatever, who would be running that? Who would be in charge of the budget? Who would be in charge of deciding what gets done or not? And I think we're going to let this unfold just a bit because there's enough variety of the answers here.
This is great as we watch this unfold, because I think, there's kind of best practices in today's world to be having, at least in healthcare, for having kind of like a chief well-being officer or chief wellness officer. We see that more in university-based systems and healthcare systems, but not exclusively. And I'm not saying for every group it's the right way to go, but I think it's interesting looking at this chart where, I think it's fairly common that HR holds this. And I think it's a great thing as we get into the assessment part, where we start looking at those other pieces, isn't it, David?
It is, and I'll tip this one over into some content that's above and beyond as well, which is look at these columns and consider that it would almost never be the case that you'd want any one function to completely own it, right? So one of the things to start thinking about is how do the different columns, how do the different groups need to work together? And it can land in different spots successfully, but coordination is really essential. So thank you for participating in the poll. Let's jump ahead now.
Thanks. And, with that, thinking about sustainability, it often happens in organizations when certain leaders have been there a long time that they know how to work together. What we also have to think about is what happens when those leaders go away. Has it just happened that way? Or do we have something in our system, as I think David was just alluding to, that will actually bring these partners somehow together? And I think that's a great way to jump into this next slide, which is, again, that reminder that there's no one size that fits all when we start really implementing the total worker health approach. In fact, I hate to say this, but when you design your assessment, which is the bulk of what we're really getting into here in terms of the details, it will be more realistic and targeted if you step back and think about, what is my organization? And think about all the variations that we have here. First, think of size. If you work for an organization that within it has 20,000 people, employees, or if you're in healthcare providers, think about that compared to 200 people. How I create that assessment is going to, of course, be different. On top of that, think about the industries we work in. What we were just talking about is, identifying hazards, looking at sources of stressors, looking at potential controls. Imagine the difference between what our healthcare workers face on the job. And you can just think about stress alone, or you can bring that into workplace violence, and say, compare that to hospitality workers. They both have those stressors, but think about where the causes are coming from. And think about job design, right? I mean, we may not realize that charting for many healthcare professionals is one of a big source of stress. So, again, where might our fixes come in? And that's way down after assessment. But we really need to think about, how do we start to, in fact, open up our doors to understanding how all those pieces play out in our organization, in addition to the piece we were talking about on the previous slide with the poll. David, do you want to give another example?
Well, leading into the other example, I will mention, think about all those differences, but also think about the parallels. Think about how healthcare and a large portion of hospitality glorify some of the stress. That there is this sense of kind of earning your keep, paying your dues, being able to handle long, intense shifts. And there are a couple other occupations on this very slide that fall into that. So let's talk about a couple of the other ones, though. So what you might call kind of the Drucker version of the idea of knowledge workers in the upper right, office workers and such. One of the tricky things there is that in today's workforce, where that people might be distributed, it might be a hybrid situation, it might be something where that informal contact between people on the same teams is limited. The idea about workload, about intensity, it's a lot harder to pick up on. I remember one of my first bosses when I worked in an office job would walk down one hallway and up the next as he was leaving each night, and remind people not to stay too late, right? There was a little well-being sense, right? He knew that people got some points, right, some way by really working hard and late, but he didn't want someone there till midnight unless it wasn't a true crisis, a true rare crisis. A lot of that's not present in today's knowledge work when you're on a virtualized sense. The other idea is the interpersonal connection between things. Do you say who's got official power, who's got influence, who's got other things? How does that fit? And then the other one I'll mention right now, you see the folks on the first responder and fire service section. I had a chance to have a discussion with some first responders not long ago. I was moderately familiar from my previous work relating to the things they faced in the regular conduct of their job, and some of the things about being out in the public and being in traffic and those hazards that they faced. What I didn't realize is some of the things that they had to deal with related to some of the administrative elements. Dee Dee mentioned charting, but things related to some of the designation and recording and tracking that they had to do, which takes a workforce that maybe has people that got into it based on their ability to very fluidly react to intense situations. And there's a new level of administrative burden. So I just wanted to mention that's kind of another piece where you say, what are the different things? You know, I know when I think of the action movie and you have the person, you know, with the explosions, right? You think of that as the stressful situation. Well, maybe there's the person where that's the situation, surprisingly enough, they're comfortable in, but some other aspect of the job is causing them stress. Dee Dee?
Yeah, that's great. I think also, and I know this is really big picture right here, but what I'm going to have you think about is your own organization. You know, what you know, where do you need to get more information? We're talking about a gaps analysis. So, you know, what is it that we are still seeking information on? And we'll talk about how to get that. Before I do that, I also want to think about is what do we have going on right now that is working? A lot of folks who are doing work in this arena remind us this is not about starting a new operation system or operating system necessarily. It's not about starting all this new. It's looking at what do we have that's working or building that we can continue to build on. And for me, the best example of that is what we've seen happen in the last couple of years, especially in the Pacific Northwest, around construction work and stigma around mental health challenges, stigma around substance use. And what we've seen organizations do when they really bring in that connection and that offering for a support and knowledge on these topics, as well as looking, what can we do to reduce those stressors? But my point about this is that may not be a full well-being program, but in those companies that have made some great gains there, that's a really important element to continue to building on and seeing what other parts of our organization can come in and support that. David, do you want to add anything else on this slide?
Yeah, the last thing I wanted to mention is, you know, you take a look at the construction work in the lower center and then that lab work on the lower right. And by the way, my joke about the lab work photo is, I know that they're not wearing eye protection, but I can tell you they're wearing the right PPE for the work they're doing, because those people, the work they're doing is posing for a stock photo. So someone just didn't tell them the stock photo needs to look a certain way. Sorry, I just, as much time as I spend in labs, I'm like, they're not wearing eye protection. Well, those folks are just there for the photo. But the point is, in construction, internationally, different types of sites, different types of projects, there is a real blend of readiness to share and engage. And if someone is presented with tools or with opportunities to engage on the issues that they face, they might not be as ready to accept or take those because they're not sure that it's okay to share, to say, we've got this opportunity for someone to share a workplace stressor, to talk about those things. And then the other piece, and I'll just mention, in the lab environment, you take a look at the wide range of workers who might be doing some very critical work at very different levels, very different backgrounds, very different career paths. And there can be some, I would say, communication enhancement that needs to occur. So just think about how your situation and your environment, it's not just about what are the risks that are faced there. It's about what does it take to get into that knowledge transfer and that open exchange of information that we need. So here we talk a little bit about the background and the challenge of what's going on. So the first piece is to consider that it is a multifaceted issue. That the photo on the right, you might, I was just bringing your attention to PPE. You might notice here that the worker's not wearing gloves, and neither is the person from the local area that's helping them. There are other questions, right, about how do they access that spot? What are they doing with it? Where's the line of fire related here? Does this person need other PPE like eye protection? Those things are all in place. But you have to remember, there are things related to this issue that you cannot depict in any photo. How long has someone been at this job today? When was their last break? How well are they trained for what's going on? Do they have some challenge that they either did or didn't have someone to mention it to? Do they have the kind of support that after their long day, the rest of their life works all right? So that's the first piece. I'm as much of a fan of the hazard hunt kind of photo as ever. You really can't do a great hazard hunt for the well-being and total worker health issues just with a static photo. That's the first one. And the next one is consider the idea there's plenty of opportunity for introductory activities that might be in the superficial category. Don't stop there. There's substantial work that goes beneath that. And there is a little pointed phrase on here, and that's the idea the employer has a bigger part to play in this endeavor than the worker. Now, that might be a little controversial. I know that there are schools of thought and approaches that say, the worker is responsible for this, that, and the other. And I'm not claiming that workers do not have responsibilities and that we don't all have our part to play or our necessity to follow certain instruction or do things, as instructed. What I'm getting at is for these efforts, there are systemic, structural, and programmatic things that need to be understood. And that those things are things the employer, rather than just saying, we hire resilient people, we hire people who are really, really tough, so we're good. That's not enough. And chilling statistic from the Surgeon General's recent report on this, 76% of the broad-based workforce participants they surveyed had some sort of mental health concerns related to the work they were doing. And that was a subset of some high-stress jobs. Dee Dee?
Yeah, I appreciate that. I would add to that, let's spin that a different way. Work can be a really positive part of our lives. In fact, we're reminded how lonely so many people are. We're reminded how important connection is for health and for that feeling of inclusivity. So that if we step back for just a second with all of this, we can, I can promise that the things that really are going to be outstanding here, no matter how much money you put into a wellness initiative, or your apps or all those things, it's the trust within your organization. It's the trust of leaders. It's the trust of your supervisors. It's the trust within your teams. It's the trust that your organization says what they do. It's that vulnerability. It's that ability to be myself and that whole piece around psychological safety. And so I know that's huge, but I would really, when we think about this assessment, that can be hard to get at. That's where the people doing the work, just like we say over and over in the safety profession, the folks doing the job understand best, not just how to do the job or maybe how to do it better, but gets in the way. And that's why engagement is such a key part or one of those 5 pieces of total worker health that we look at when we identify the elements.
Dee Dee, thanks so much for bringing up the positive. I tend to be living in the world of the challenges so much, but think about this and envision this. Envision when you work with a bunch of folks in a traditionally high stress environment. Imagine being able to walk on to a place of work or a job site and ask the people that you come across, so, hey, are you enjoying yourself? In the sense, that this work, you feel like it's productive and useful, but you enjoy it, you appreciate it, it fulfills you. Are you having good interactions with other people? Are you learning something? Do you know how and why that you matter on this job? I can picture the sort of workplaces where people might laugh at you. They might stop in their tracks and give you a side-eye glance. That shouldn't be a pipe dream to think about work being something that's positive and energizing. But we know it's also not something that you could just put up a poster and say, yep, that's the way it is. Wanted to talk just a tiny bit about frameworks and models. You've already seen our discussion about well-being and total worker health and about NIOSH, putting that together into a system, an approach. It goes beyond that. The first one I want to mention, and this is a big issue, a big question, what's the relationship between wellness and well-being? And it's a little bit strange, really. And here's why. If you want to get careful and technical about it, wellness is really a narrow thing that contributes to well-being. And wellness has to do with aspects of your health or fitness or your physical condition in some way. You can talk about that, and to not get too far afield, wellness can get into the idea of saying lifestyle and other things that keep disease at bay, or management and control of chronic disease. Most of the world of wellness has to do with one of those two things. But take a look at the left side of this graphic, the 8 pillars of wellness. We didn't create this. This comes from a pretty large organization, and they've chosen to call what we just described as well-being wellness. On their very website, they mention that wellness is easier to communicate, people understand, and that they're more or less okay with using it in an inelegant way. We try not to. We wanted to say, so wellness really is a subset of these other things. It's one piece. Wellness is not the totality of this, but there are a number of models. Before I get to the Surgeon General's, Dee Dee?
No, I'm just agreeing with you, and I'm saying we have to be careful about our use of language. And there's not a right language that works for everybody. And that's also what makes this challenging. In addition to all the frameworks, you could be following these frameworks and models and be implementing a total worker health approach as you do it. So it's not an exclusive thing. And I think that's probably what you were about to say, David. So go ahead.
It is. And really take a look from the rest of our worlds here, right? Look at the difference between the words safety and security, between health, hygiene. There are a number of words that already end up being pushed or pulled one way or the other. The other one I wanted to just mention, though, the Surgeon General put out a framework for workplace mental health and well-being, and this was being developed before the pandemic hit, but it really took root and was released in the midst of the pandemic. It's once again, it's another online available item as part of that report. Take a look not just at the items inside the loops, but look at those small ovals with the different items on the outside. So Surgeon General's team put together something that really wasn't trying to be completely comprehensive as much as get after some of these things related to stressors and mental health and the things that fit into that. So another interesting model. Please do not think there is one central model, one set of blocks or squiggles that completely defines all of this. Although you will find, with 3 or 4 or half a dozen, you can pretty much encompass the whole set of ideas.
Yeah, I think as we jump into this slide, I think it's a reminder for most organizations right now. Resources are tight, staffing is tight. And so it's really critical that we look at what we are doing and how we can build and enhance on that. I think there's few organizations that could all of a sudden say, we're going to put everything over here and let's do it this way from the top. But really, let's now get to how do we know what to do? So there's a number of resources as we've referred to. So for example, there's a way, thanks to the Harvard Total Worker Health Center, that we can look at, well, how integrated are we within our organization? That's really helpful. That's helpful to rate that, but I would kind of look at a bigger piece than that if you're really looking at your gaps analysis. So just to remind us all, I know many of you have done safety gaps analysis before. What's challenging here is we're expanding it to really those things touching safety or occupational safety and health, wellness, well-being. I am willing to say I think it would be impossible to do a quantitative look at this. And that's not even really what we're advocating. It's clearly got to be a qualitative walk through this. But these are the 1, 2, 3, 4, 5, 6, 7 key items that we've identified in trading notes about how you would do this. And we're going to jump in and we're going to spend some time on this slide. And I think I see a couple of questions that I may even bring in as we go through here. So first, and I actually do think this is a first thing, you know, I mean, things are going to happen at the same time, but what's really critical, and we've already referred to this, is that interdisciplinary team. And I think you can see some groups we've listed here. I think it could be a really great experience for you if you haven't done it to write down who would be your team, who is your team, who's already talking in this sphere, who are you leaving out? You know, if you've got performance excellence folks helping your organization move forward, are they part of this conversation? Certainly what we risk with all of this, where there's so much interdisciplinary connection or potential connection, is that we are either duplicating, we're in conflict, or we're just kind of, I guess that would be conflict, going different directions, or, you know, we're not even aware of what other parts of our organization are doing. So the very first piece, right, is connecting that interdisciplinary team. There are some resources within this document, the fundamentals, that get you started on that if you haven't done that. I think, David, what do you want to add to that?
I think there's two things to think about on the way in, which is, number one, the goal is the idea of developing an approach and a better future. And it is not so much about saying, hey, we want a clean set of data, right? I mean, it's, you do want accurate information, but to say we want to maximize the impact of what's going on, that's number one. But then the other thing I would mention is that if you're looking at efficiency of moving through some steps as opposed to impact, you might end up with the wrong team, right? You might end up with a team of saying, these people already have done this, you know all about this. And, you know, and one of the first times I had a chance to work with Dee Dee, you know, she was in the spot of being the person who was one of the Mount Rushmore of total worker health, with some colleagues around who maybe would have been ready to defer and say, you know, Dee Dee, you can do more. I think it's important to say, hey, if we've got some expertise or some specialization on our team, we want people that represent the other exposed personnel, some of the potential controls. And that's why the team itself needs a little bit of a ramp up and a forming.
Yeah, I think I'd add to this. I would encourage you, if you can, at this point, having your senior leadership available or at least familiar with what you're doing, with their backing, is going to make your experience way better. As you know this, we all know this in our fields. But it will save time, it will save efficiency, it will save repeating your message to those different teams that you're going really bringing together. And I think in the end, it will absolutely gain more trust, and it will require you to be authentic to eventually sharing what you find and having folks there to be interested in that. Let's jump down to the next one, David. So clearly, as we do this, we are identifying existing relevant programs and policies. Are we going to identify every policy that exists? No. But again, try to think about, we're trying to look at those things that touch safety, health, and well-being. What are those things that we have? Are they, and if we have an ability to get more info on that, like how well are they going? Are we about to rewrite this one? Is there something ahead of us over here that this team's already working on? Again, we're just really trying to see, what are we missing that touch? So this could be our leave policy. This could be our, certainly many safety policies follow in here. How well are our safety committees moving? How well is engagement? And there's too much there to even mention, but David, you probably want to point out a thing or two on that.
Well, first of all, it doesn't have to have the label, right? It doesn't have to say, oh, this is our well-being program or our wellness or our total worker health or whatever, right? So there is a need to maybe cast a wide net when you're thinking about that. And some of the pre-work involves not just looking at your documentation, but even asking people, you know, what do you turn to? What helps you? What's useful? And I'd say this is one, a broad net is the key, including informal things, is to say, yeah, you know, we gather and we do this handoff, we do these other things. It doesn't necessarily even have to have a name for you to include something that's part of your activities.
Yeah, that's great. You know, the next piece, this is going to vary depending on the size of your organization, how much time you have. It might be that instead of individual confidential interviews, you do it with teams, right? You're working with the safety committee, you're working with an operations committee, and you're doing more of a group focus. I would tell you that I think, as you can imagine, through confidential interviews, and I mean confidential, we have to really think about, how do we make sure that those people that are willing to speak to us for an hour or half an hour, whatever it is, can trust that what they say is safe. And that that means your leaders agree with that. That means that you may not be sharing job titles. There's a lot of pieces to this, and there's lots of experts that are out there doing interviews. I would say this is where how you go about that depends on whether you are working on a research project that you hope to publish, or you're working on something that is literally going to stay in the hands of your organization to improve how you're going. Both ways you need to be correct about confidentiality and all of that. I think this is where you hear things like, there was a great question, how do our leaders, what do we do to get our leaders in the field? This is where you get those stories, right? Hey, this leader, and you may see it reflected in survey data. This leader knows how to go to the front line. This leader knows how to engage in a safe manner. And what's important there is not so much, yeah, that's great for that leader, but is this a consistent thing happening? Are other leaders needing some education, some training, some mentoring on that? That was just literally one example that can come from these confidential interviews. David, you want to share?
Well, one of the things, kind of just a twist on that that comes up sometimes, and it's the idea that where is the place for questionnaires or surveys? And I would say they're on either side of what we're talking about here. Yeah. That it is sometimes useful to take the temperature of an organization with some level of survey. But if you look at the depth and detail related to the kind of things you're trying to get at, many of the organizations that might be in the midst of a gap analysis don't have maturity related to the terminology and the implications. So you say, after you've got programmatic things being improved, that's where more survey use can make more sense. But be really careful about saying that we're going to find out what's happening on the front lines strictly via surveys. It can be a great pathway in, but I do think, boy, there's so much opportunity if you've got that approach that involves the direct connection with people in different parts of the organization.
That's great, David. I think that allows us kind of move faster through this one slide as I kind of see where we are on time. Again, that's where you're getting those surveys, and we're not here to tell you whether you should use the WellBQ or any other survey. What I do think we all have to caution against is doing too many surveys. So if your organization is already using a survey that gets at some of these questions, sometimes it might be, rather than get a whole new survey in, is how can we augment that with some other questions that might get us at some well-being or burnout questions that were not already available or that we're not already sure of. And that really gives us that nice quantitative data that we can match with, this qualitative confidential interview type of info. I think that, what we're really trying to get at is what are our core values and messaging, and all this will really help us see for now what are the gaps, and really developing priorities. We can't do everything tomorrow. So ideally, we'd be looking at short-term action items, longer-term, medium-term goals for our organizations to really move towards supporting worker well-being. Before I go to the next slide, David, do you want to add anything else on this?
Yeah, the only thing I wanted to mention real quick, and there was one question that mentioned the idea about innovation coming into some of this. Yeah. And I think innovation is a spectacular thing to be putting on your map. But remember, the last piece of this is identify priorities, plan next steps. That means as it relates to the results of your gap analysis, this is the gap analysis, not the gap closure. Although there's two sides of the innovation idea. One is you want to look for innovations that are budding or that maybe need to be identified and spread. So with that, I think we can move on.
Yeah, and I'm going to address as we do that this question. At some point, there's super saturation. When is enough data to make a decision and take action? I love that question. And I truly believe in today's world, you can get an awful lot about your industry just by looking at the literature. You certainly can in healthcare. You can get the big pieces. You can't get the little pieces. But we really have a pretty good sense of what is impacting us in our workplaces and what are some good things to move ahead on. So I really do appreciate that question. And really, all of this falls in line with readiness. You may be ready and excited to move ahead, but we've got to look at the other parts of our organization. We've got to look at the reality of what's happening fiscally, what's happening within structure of the organization, and really looking at ideally actions that can be taken now so that our workforce does see that we care and that we are moving. David?
The pitfall that you can run into with an endeavor like this, and it is a real double-edged sword. When you get started with an evaluation of your gaps, it is common for there to be people who are so expectant, who are so ready that they come to you saying, is this happening? Is this an initiative? Are we ready to kick off all kinds of big, great things? Now, some other organizations are on the other side. They're so not ready that they'll reject and they'll say it's a pipe dream, whatever. But I want to prepare you for organizations, maybe even those with significant challenges, where you may find people who are really interested and hopeful. And you need to prepare to communicate during the process what it's part of. If you say you're doing this just as an academic exercise, it's going to hit a few top people's desks and then end up in a drawer. That doesn't make people feel very good. Are there commitments already from senior leadership? And this reminds me of something. A pretty elite special forces person a while ago talked to me about when they were evaluating people's physical training or physical fitness or other stuff. And he said, whatever you're evaluating right now, what are the different ranges that what's the bottom and the top of what you could imagine? And how will that change what you do? If you get an evaluation where someone's at the bottom of this or at the top, how will that change what you do next? And I think as an organization, you need to be ready to say that, to say, well, we're prepared to take some action, do some things. We're doing this to find out where to put our resources, how to sequence things. And you will find you've got the opportunity for the benefits to begin before the evaluation is even largely done. But you also can find that people could end up frustrated if it appears to be just a closed-ended exercise. So be careful. Be careful, when you get out there in the field, be ready for that. Dee Dee?
Yeah, thanks, David. I know you can't read this picture on the right, but it does come out of the fundamental document. And it's really a reminder to us that there is so much that could be encapsulated that is when we start thinking about worker well-being. Everything from salaries and benefits to fairness to, absolutely job design. So I share this as not something to overwhelm us, but think about opportunities and what is the biggest and most important thing for us to get to now, and where might we want to be in 2, 3, 4, 5, 10 years. And I think that can be helpful for that. And this is really just kind of a reminder about that too, is there's a lot of partners and it can be overwhelming how much information is out there. So on the one hand, you don't want to implement in a vacuum because there's so many people sharing great things. I think sharing notes with someone within your same industry is super helpful. There's lots of info from the NIOSH Centers of Excellence, and you'll see that on our last slide. And certainly that, we like to remind over and over again about the hierarchy of controls, but we really do have to be the ones, if we come with that safety and occupational health lens, of reminding about job design. We can't always do it the way we'd like. And during COVID, we learned this term, the layered approach, which sometimes is essential. But it's really important that it's not about fixing the worker. It's really about trying to, and somebody made the comment about resilience, right? That people can run on resilience only so long. There are so many factors in that. Are we going to jump into our next poll?
I think, well, yeah, we can go right ahead. Actually, for the sake of everything that's on the table, that's not a bad thing to do right now. So, have you quantified the loss costs associated with workplace stress and mental health issues? While you're answering this, I will relate this to one of the questions that were asked. Related to, does our JHA program need to include elements of wellness, not just ID hazards? How would we do that? And I'll mention, it is tricky because the standard JHA, JSA type process is usually tuned towards physical hazards that exist at a point in time. That's not to say that you couldn't connect it in some way, but it really structurally can be a challenge. And I say that because the idea about quantifying loss costs can be a little bit more difficult, right? You might have one line item for stress-related claims, and if you're answering yes, sometimes that is because you get the stress-related claims piece, but going beyond it can be tricky. So let's take a look at what the results came in for here. It looks like the majority of respondents have not quantified. And just to reiterate what I was saying a moment ago, that's understandable because there's not a great deal of structure for that. And you look at the way the insurance and coverage picture for this all fits, it's not as naturally lined up to do it. Now, that doesn't mean it's not something you should seek to do. It's just, it's harder to get there, but very useful when you can. Dee Dee?
And I don't think it's surprising. So I think this is going to be our, looks like one of our final slides before we get to kind of taking a couple more questions. You know, and in terms of addressing those gaps, we just kind of want to make sure that we, in fact, share some of the key take-homes. This is a big topic to talk about in an hour or less. You know, that leadership message, we can't, I think, underestimate the importance of that. Those initiative planning efforts, looking at where potential sinks already exist, And really, safety committees can be big champions, especially if you're with a smaller organization. I have seen companies do great work using their safety committees as champions to really further the well-being pieces. They're not the only group, right? But they're really actively engaging with other groups, and they're feeling that they're being listened to and trusted. The final piece I'll make, well, two more, sorry. The supervisor training, we know that's essential. You know, if you're in a big enough company, your HR team is doing supervisor training. But the piece is are they looking for some different things that foster that safety, supportive environment around well-being? Similarly, somebody asked, are our employee assessor, are our EAPs part of this? Yeah, they're part of it. They can't be the whole thing, you know. And we really need to work on culture. Most commonly, folks don't access our EAPs, and they do more when we start to build our well-being.
Quick note on this one. I think one of the ways to take a look at proposed measures to address the gaps, the more narrow and the more compartmentalized they are, the more likely that you're not thinking systemically. So that's a piece of it, right? Is to think about that integration. Let's go ahead and get through to our I didn't mean to skip past that last one, but I guess we are close to the end of our time here, so maybe we need to.
Yep. So these are some sources we talked about, sources of information and training. We've referred a lot to the first one. There's much more out there, of which all three of these resources will in fact lead you to others. David and I are always available to help share other information too. David, you want to jump into a question?
Sure. So let's take a look at a couple. So one question that came in was, what's the timeline when ROI will be visible for senior leadership? And I think that is a great pre-assessment concept to get into, because if the assessment needs to be done on a shoestring, the timeline is long, and maybe long after the assessment is complete before any ROI happens. When you look at a more in-depth set of assessment activities that involve engagement up front, ROI can be measured during the assessment phase. So I guess I would say that there is a leverage with having the engagement and the participation factor front-loaded on that. Didi?
Yeah, I'm looking at some of the other questions.
I will mention one of them. Someone asked about, is there a mini mastermind group? And I'm taking that as interest in participating in some discussions about furthering this. There's a few different opportunities. Hey, anyone else who's interested in that, by all means, throw your interest into the questions or chat, because I know we've had some discussion groups. It would be great to get an understanding of who's interested in getting a little bit deeper on some of the nuances of this.
Yeah. You know, one question that was asked is, what do we think about the well-being apps that are offered by health plans? You know what I would say is absolutely look at what your health plans are offering, because those are services you already may have access to. They may not be your top priorities, and they may only speak to a portion of your employees, but you should certainly know about them. And I think that it's a great example of, there's just many different sources of where we might get our info, and we may not be even familiar with them without being part of that team to discuss with our benefits folks. Yes, I think there will be a recording. Somebody asked the question, will there be a recording? Yes, I think there'll be a recording.
So there was one more question I wanted to at least touch on. It was a question about how to assess costs, and I'm taking that to connect with when we talk about, have you quantified the costs, and about what methodologies have been useful. I'll put this in the broad bucket that connects with what work has been done related to upstream or leading indicators. Not that that's the same topic, but where that it's a tricky thing to crack, but there has been some good analysis. And I guess what I would say is taking a look at some of the actuarial work that's included kind of the layered factors related to certain stressors and things that go beyond the length of a typical claims cycle. But that's a workshop unto itself. I don't think that there are clear models out there, but it doesn't mean we shouldn't start down that path. Thank you for that question. I think that brings us just about to the end of our time here. So I think I should hand back over to Dave.
Yeah, thank you, David and Dee Dee. Fantastic webinar, and also fantastic way that you worked the Q&A into your session, kind of ongoing. You tackled all the questions that came through. So thank you for that. I would just let everybody know, if you still have a question you'd like to ask of Dee Dee or David, go ahead and submit it, and we'll forward your questions onto them and they can follow up offline. So let me just wrap it up. First of all, I'd like to thank our sponsor, BSI, thank our speakers, Dee Dee Montgomery and David Natalizia, and also just a reminder, at the very end of this, when we sign off, there will be a feedback form. So if you could just take a quick second to answer those questions, we would appreciate it. Thank you, as always, to you and our audience for your attention and your fantastic questions. So on behalf of EHS Today, I'm Dave Blanchard. So stay safe and stay healthy and take care. Thank you.